The G20 Health and Development Partnership is working to promote global health diplomacy and to help G20 countries coordinate their health innovation strategies to tackle the growing burden of diseases, including HIV and AIDS. Our reporter went to Geneva to find out more.
The pandemic has touched all of our lives, and it has, of course, impacted some much harder than others. Progress into diagnosis and treatment of some of our most deadly diseases, including HIV/AIDS, has been scaled back. Those behind a unique partnership are determined that this 40-year-long campaign continues to gather momentum and make a difference. The G20 Health and Development Partnership was set up in 2017 with the aim of putting public health at the top of the political agenda. It brings together 25 like-minded partners from the public and private sectors, academia, civil society and politicians across the G20 to ensure a more joined-up and robust approach to tackle infectious diseases such as HIV/AIDS and non-communicable diseases such as cardiovascular diseases to address health inequalities.
Well, we haven't got to look at diseases in silos because they all impact one another. And particularly in relation to HIV/AIDS, it's critical that we don't roll back the progress that we've made. And for example, if you look at co-infections where someone in a vulnerable community might have HIV/AIDS and COVID-19 and possibly even tuberculosis, then it's a death sentence. So it's critical we don't forget about these other major diseases.
Dr. Nabil Gohir works for an organisation established back in 1977 that helps people in low and middle-income countries right across the globe prepare for pandemics, as well as diseases such as malaria and polio and HIV. Dr. Gohir and his team develop primary healthcare systems, help people access digital health solutions and are committed to global public health equity.
Well, this work is very close to our heart. At PATH, we are a group of fighters. We fight with pathogens and we fight with inequalities in societies, and we focus on the last mile. In Vietnam, for example, our work is with local communities where we educate them on sexual health. We tell them what are the risky behaviors and some of the preventive things. And all of this work is very, very collaborative because we believe that none of us is as strong as the all of us.
UNITAID is a global organisation that invests in new ways to prevent, diagnose and treat, among other diseases, HIV/AIDS.
The funding situation for HIV/AIDS is a concern. First, I think that we have more need to address the situation of COVID-19. But also COVID-19 is a threat to the funding to fight HIV. And we need to be clear that the progress that we have been making all together and with the countries is at stake. And we need to have more resources to address this challenge in terms of lack of testing and lack of access to treatment.
It's also crucial that politicians play a pivotal role in driving forward the agenda for HIV/AIDS, putting policy change front and centre of the government's health agenda.
Clearly, obviously, in those countries that can afford retrovirals and ongoing treatments and also more work to see whether new treatments can be developed, the situation is far better and AIDS is now not a death sentence. People can live with it perfectly well. But in the rest of the world where retrovirals are very expensive or the health service structures aren't as well established or there's a lot of bigotry and misinformation about what happens if you take AIDS treatments, there are still huge areas of education that we need to make sure is spread out.
The G20 partnership, putting a resilient public health system and health equity at the top of national and global political agendas for all, and ensuring the fight to eradicate HIV/AIDS continues 40 years on.